Good morning or afternoon, everyone. This is Megan Glass from OPWDD. We'd like to thank you for joining us today for our presentation on the post-day service retainer program flexibilities. We have several speakers today, so we'll pass it over to Kate Marley to begin the session.
So good afternoon, everyone, and thanks for joining us. I just want to start with a few kind of technical notes. First of all, the focus of today is really for day habilitation and site-based pre-vocational services providers. And this is a sort of technical discussion where we're going to focus on the information that was sent to all providers earlier this week related to the flexibilities that we are now implementing. So we're going to go through all the slides in one take. We're going to ask you to please mute your line. We've muted you here, but we're fully subscribed, so it's just very helpful to make sure we retain sound quality. If you have any questions, please enter them in the box on the lower right-hand side of your screen. We will address those once we finish the slides. We're going to do our very best to answer all of the most frequent questions during today's session. Also, we will be recording this session, and that will be available as soon as possible on our website for folks to review afterwards. Next slide. So today's discussion is going to focus on technical guidance related to billing and service documentation following the July 1st end of the Retainer Day program. What we are implementing here are temporary measures to assist day habilitation and site-based pre-vocational service providers with re-engagement of day services. The particular topics that we will be focused on are flexibilities in the program day duration, a special provision for the period of July 22nd through August 23rd, where we will have retroactive implementation of these options for providers, the claim submission process, and the claim limitations that will be in place should you choose to participate in this. Finally, we will also look at the community hab and community-based pre-vocational services flexibilities that continue to be available via the interim guidance that was provided earlier, and finally the continued provision of group community habilitation residential for folks who live in IRAs. So let's get started. So as everyone knows, the day service retainer program, under that program, the last day to submit a claim was July 21st, 2020. After that date, we do not have authorization from CMS for any additional provision of retainer days. So what we are talking about today are options that will be available effective July 22nd, 2020 through October 14, 2020. So we'll be providing additional flexibility for day habilitation and pre-vocational services providers, site-based pre-vocational services, but those will be time limited. And I also want to stress that these are options for providers. So while you can use the flexibility that we're going to be discussing today, that will be your decision. There will be limitations that will be in place if you choose to use those options. So with that, we are making changes to the definition of the program day duration for all day habilitation and for site-based pre-voc services. So I think as everybody knows, the program day duration is defined in administrative memoranda for the two services. And it defines the type of activities that can count toward the program day duration that counts toward a provider's billing. So what we are doing between for this particular period, so beginning July 22nd through October 14th, the program day duration will include face-to-face service time, same as always. It will also include time when staff are engaged with individuals via telehealth, delivering services. So those are the special provision in place because of our Appendix K in response to COVID. During this period, we are also adding meal times to the time that can be included in the program day duration. Other requirements in the administrative memoranda remain in place. So, for example, the administrative memoranda for day habilitation and site-based prevocational services do not allow to-from transportation time to count towards service delivery. That provision is still in place. We are modifying it to allow the COVID and to allow the telehealth services and also meal times. So let's go to the next slide. So I think as everyone understands, there's two major components for billing standards for day-hab and site-based prevoc. The first are the documentation and delivery of staff actions derived from the person's staff action plan, and the second is the program day duration. During this period of July 22nd through October 14, we are not changing the requirements for staff action documentation and delivery. So, for a full unit of both services, you are required to deliver at least 2 services drawn from the person's staff action plan. That's the same requirement as always. And for a half unit of service, you must document at least 1 staff action drawn from the person's staff action plan. Again, same requirements we've always had. What we are changing during this period is the program day duration requirement. So, for services between these dates, July 22nd through October 14, we will allow a program day duration of at least 2 hours to count for a full unit of both services. So, a full unit of day-hab, a full unit of site-based prevoc. For a half unit, the minimum required program day duration is at least 1 hour. And I think, as everyone knows, the requirements that exist before this is put in place were 4 hours for a full unit and 2 hours for a half unit. Providers do not have to use these billing standards, so they can use the existing standards of 4 and 2 hours. But if they opt to use the modified program day duration requirements, claims must be submitted using the revenue code 0249. And thankfully, we do have Earl Jefferson on, and he'll talk in just a bit about the claim submission process. But it's just important for everyone to note that just like you had to define in your billing a retainer day versus a service day, for this period of flexibility, you need to identify a claim that meets the regular standards in accordance with the ADM for the program day duration, and those that meet this modified minimum standard of 1 or 2 hours. So, with the issuance of this guidance and the flexibility to bill a unit based on half of the program day duration requirement prior, we are rescinding the flexibility that was previously issued regarding the ability to count non-face-to-face service time when a day-hab staff person or a site-based pre-vocational services staff person delivered services to a person. So this guidance was issued earlier this year in response to COVID. It's interim guidance, and it was under a subheading called Delivering Services and Maintaining Social Distancing. This was the provision that allowed if staff were to travel to a person's home, for example, and provide non-face-to-face services with the person, that could count toward the claiming period. So that will be effective August 24th, which was essentially the day that the guidance was issued. That will be become in effect. Now, what that sets up is a situation where we are issuing guidance, but it has a retroactive approval date. So, the new guidance that we're issuing, the 1 and 2 hours, takes effect July 22nd. Many providers will have already billed, perhaps, day habilitation and site-based pre-vocational services during this period to a person, and they may want to revise their claims in order to use the new standards that are now in place. That's fine, and thankfully we have Earl here who will talk in a minute about how to adjust your claims. But that said, it's important to note that a provider can use either the flexibility to count the non-face-to-face service time that had previously been issued in the COVID interim billing guidance during this July 22nd through August 23rd period, or the modified program day duration requirements of 1 hour for a half unit and 2 hours for a full unit of service. So you may want to look at your service delivery for this prior period, and it may be advantageous for you to revise a claim and use the new methodology. That's your option. You don't have to. So if you've already submitted claims and you want to leave them as is, that's perfectly fine. You may want to go back and look at the service delivery and see if you can reach a higher standard of claiming for this period. That is okay too. However, you have to remember that you can use one or the other provisions. So you cannot count staff travel time and use a program day duration of only 2 hours to bill a full unit. It's either or during this period. We're simply implementing that, understanding that it is retroactive. The new rules are retroactive and go back to July 22nd. And for many providers, there may be claims that are already submitted, or you're preparing claims now for that period. So what I'm going to do is I'm going to turn it over to Earl Jefferson, who can talk through a little bit about the submission of claims and the adjustment process, given that there may be providers based on this guidance that will be making adjustments to their claims. So if I could pass it over to Earl.
Great, thank you, Kate. I'm assuming everyone can hear me, right?
We can hear you, Earl.
Very good. Okay, thank you. Okay, so first a couple of points. Kate, as Kate was just mentioning, the 0249 revenue code is really important to ensure that that is included on the claims that you submit under these allowances that we've been talking about here. Just like what we did for the retainer claims, this is what is going to be the identifier that says these are claim submissions that are not meeting what the regular standards are. So down the road, if there's an outside auditing entity looking at claims, that is the primary identifier that's going to say these are claims that are based on what the allowances are that we have through the K waiver. So it's important that any of the claims that you submit using these duration allowances have that revenue code on them, because that is the single identifier that we're using to put claims in this particular category. So first and foremost, make sure that you're using that revenue code when you're submitting based on the allowances that we're talking about today. Secondly, the adjustments that we're talking about on this slide, although we say day-hab claims because we have a lot more day-hab services and day-hab providers than site-based pre-voc. This is also applicable to site-based pre-voc, so I just wanted to make that clear that we're not just talking about day-hab claims, we're talking about potential adjustments to site-based pre-vocational service claims as well. So with that, because we have a bit of retroactivity here, if your agency has submitted claims for either day-hab or site-based pre-voc, say for a half unit of service, based on the allowances now with the duration and your ability to now meet a full unit requirement, what you can do is you can submit an adjustment of any of those claims that meet the criteria we're talking about here. And as I think most providers are fully aware of how to submit voids and adjustments on their claims, but certainly if you're looking back at services you've rendered and you meet these allowances, you can do an adjustment to the claims. Essentially, the TCN of the original paid claim is what's going to drive those adjustments. So you're doing a new claim submission, you're inputting the TCN, the transaction control number of the prior paid claim, and on the actual bill type, the third digit, and it's not on here, but again, if there's questions about this, you guys can email me or email the Central Ops email account. But you're essentially just adjusting the claim from the half-day rate code to the full-day rate code. And this follows the normal process that you're using whenever you're doing claim adjustments. There's a third digit on the bill type, which is a 7. The 7 of the third digit of the bill type is what indicates that there's a claim adjustment. And again, I think most providers, their billing departments are very aware of submitting claim adjustments or voids. And it's just a matter of updating the rate code on the claim from a half unit to a full unit, and that's driven off the TCN number of the claim. You're doing this as a new claim, as we have here on the slide, but again, the main things to keep in mind is that you're using that transaction control number, or TCN number of the prior paid claim, and indicating in the adjustment loop of the claim of the 837 claim submission that you're performing an adjustment. So really, it's a pretty straightforward process. Again, you have to use your TCN off the prior paid claim, but if you look back and you meet these duration allowances for either group day hab or site-based prevocational services, you'll be able to do those adjustments based on the information from the prior paid claim. Now, the other thing that you should input on the claim submission is also that revenue code that Kate mentioned and I just mentioned before, the 0249. That's certainly an adjustable field on the claim submission. So when you do the adjustment, just make a note that the typical revenue code that you put on the claims needs to be updated to indicate the 0249 revenue code, because again, that's the identifier that's going to tell anyone looking at these claims that these are being submitted based on the allowances that we procured through the K waiver. And I think that's all I have to say on this slide. Certainly as questions come in, I'll be available to answer them.
Terrific. Thank you, Earl. I'm sure that we will take advantage of your expertise for questions. So let's talk a little bit about this. This modified program day duration is an option for providers. You don't have to use it, but if you do use it during this period, there are some limitations that you need to be aware of. So, as folks know, I think, today, if somebody receives both day hab and supplemental day hab, for example, a person in a day, as long as they don't live in a residence, can get basically a unit and a half of service. If you use the modified program day duration definitions that we're talking about here, of 1 hour for a half unit, 2 hours for a full unit, you cannot bill more than 1 full unit or 2 half units for a person in a given day. So think about it this way. We're allowing 1 hour to be a half unit and 2 hours to be a full unit. If you deliver 3 hours of service in a single day, you cannot bill a unit and a half for that. So we're providing this flexibility, but there will be a limit on, if you use this flexibility, how many units you can bill for a person on a given day. That said, you may be using these provisions for many folks, and let's say there is someone that you serve who you will be meeting the regular standards for a full and a half day of service. You can bill that, as long as for that person on that day you are not using any of the modified provisions to obtain the full unit and the half unit. You have to meet the regular billing standards in that case. Also, there are limits in terms of the total the total number of claims that you can submit for each service. So for providers that participated, and almost everybody did, in our day service retainer program, I think you're well aware that there were service units limitations based on the prior period of July 1, 2019 through December 31st, 2019. So if you use these modified billing standards those limitations are still in place. You may bill the modified standards up till you reach that average unit from that prior period. And we'll talk about that in a little bit more, but basically it's the continued limitations that we had in place for the day service retainer program. Also, you'll remember, for those of you who participated in the program, that we did allow some interchange between folks who would use Community Hab, who were also perhaps using Day Hab, or formerly participated in your Day Hab program. That continues to be an option for providers. However, the total revenue, and it will be adjusted as needed based on rate changes that happened in the intervening years, but it may be that you are billing less of your Day Hab than you did during that historical period now for a number of reasons, but you are going over your Community Hab limit in terms of those units. That's fine as long as the revenue overall across all three programs remains at or below that prior period, July 1, 2019 through December 31st, 2019. Again, the same types of provisions that we had in place for the prior retainer day, those would continue in terms of looking at the total limits for billing during this period if you choose to use those modified program day durations. So this slide is, I will say, quite frankly, mostly Greek to me. However, OPA, the Office of Pool Administration, is the mailbox that the Department of Health uses to convey information regarding rates and other important information. And in OPA was where we provided the reports to agencies related to that prior period of July 1, 2019 through December 31st, 2019. So when we talk about what are the limits for each service based on that prior period, the reports are going to be in OPA, and we provide the links to help you review those reports and understand what those limits mean for you. So with that, I am going to turn it over to Abiba Kindo.
Can folks hear me?
Yes, we can hear you.
Great, thank you. Good afternoon, everyone. So I will be covering the next couple of slides, which speak specifically to service authorization and other noted flexibilities. So slide 14 should be folks should be pretty familiar with the contents on slide 14. We have shared this in previous presentations when we spoke about the flexibilities for the retainer day program. And so the contents of this slide really speak to those providers who participated in the day service retainer program from March 18th through July 21st. These providers continue to have the flexibility post-July 21 to offer Day Hab, Community Hab, and Prevocational services to meet the needs of folks that they are currently serving without engaging with the regional office for additional authorizations or to submit a Developmental Disabilities Profile 1 form, DDP-1, or DDP-1 supplement. And of course, the flexibility needs to be provided within the limits of the day service retainer program that we had previously outlined. These same providers who have participated in the day service retainer program may also offer these same services, so these suite of services, Day Hab, Prevoc, and Community Hab, to address a crisis situation for an individual that they are currently serving, again, without contacting the regional office for authorization or submitting a DDP-1 or a DDP-1 supplement. We had previously shared with folks the COVID-19 addendum, and so that form can be used to update the life plan as well as the staff action plan through October 14th, 2020. And just as a reminder, the provider initiates the updates and sends, the COVID-19 addendum form to the CCO care manager. The CCO care manager then signs and distributes to the individual, the service provider, and sends a copy to the OPWDD Central Operations mailbox that we had previously communicated to folks, and I also believe is noted on the COVID addendum form. Next slide. Lauren, can folks hear me to advance the slide?
Hi, Biba. The slide is advanced. I think there is just a delay in what the viewers can see.
Okay, perfect. It just popped up. Thank you so much. So continuing on with the updates on service authorization, and again, this slide should be familiar to folks. If an agency has not opted into the day service program, so those providers who did not sign and submit the attestation, then the sort of typical pre-COVID authorization process needs to be followed. The individual or the provider would contact the care manager, and the care manager would then contact the DDRO and request an amendment or an authorization for an individual who is seeking to change services that they're currently receiving. The person's current life plan and staff action plan will remain in place until the changes are made in accordance with the guidance that we had previously issued and is currently on our website, the OPWDD COVID-19 care planning guidance document. Next slide.
Again, the slide has progressed forward, but unfortunately there is a delay in what the viewer can see, so please just bear with us. Thank you.
Thank you. So next I want to talk about community habilitation and community-based pre-voc services. So as Kate has previously described, we had outlined for folks interim flexibilities which remain applicable. These flexibilities include the use of telehealth to provide services remotely. We also continue to allow for people who live in a certified residence with less than 24-hour staffing to receive community hub services in the residence, and the flexibilities regarding non-face-to-face services remain in place, and these flexibilities are described in the delivering services and maintaining social distancing section of those specific service-related documents, which are currently posted on the OPWDD website. Next slide.
The slide has progressed, if you would like to continue.
Okay, thank you. In terms of flexibilities that we are allowing to continue forward, Kate had also mentioned the continuation of group community habilitation for the IRAs, specifically for folks, for providers who operate supervised IRAs. Providers may continue to deliver and bill eMedNI for group community HAB-R, who are provided to IRA residents who prior to the pandemic participated in a day hab or pre-vocational service that was delivered by a different provider. The claiming of the group ComHab-R by the IRA provider is subject to the authorization of OPWDD and the authorized monthly unit that was previously referenced for the prior period. No claims for group community HAB-R may be submitted on a day where an individual had received day have or pre-voc services. So we just want to note those limitations that remain applicable for those who continue to use Group Com Have R. And so now we will open it up for questions and a discussion.
So if folks could, thank you, Aviva, and thank you, Earl. If folks could make sure they're getting their questions into the box. We'll start in just a minute. We're just going to go through them and identify some of the most frequent questions. So if you'll just wait for a minute and we'll get started.
Will a recording of today's session be posted?
Yes, we are recording this session, and as soon as we can, we will have it posted to our website, and we will send a notice out to participants that it is available.
Can we bill retainer units for service dates after July 21st?
No. So the last day for retainer claims was July 21st. So on July 21st, you could have billed a retainer day, and that's fine. On July 22nd, the retainer day program ended, and there can be no more claiming of retainer days for service dates July 22nd and after.
Is supplemental day have included in these flexibilities?
Yes. So we talked about group day habilitation. That would include supplemental day habilitation. The same rules would apply. So when we talk about services being limited for day habilitation to that prior period, it would be your limit would be based on both your regular day habilitation claiming and your supplemental day habilitation claiming.
Do these flexibilities apply to all individuals receiving day have and pre-voc, regardless of their living arrangement?
Yes. So agencies that deliver day habilitation or site-based pre-vocational services can use these rules for anyone, whether they live in a supervised residence or whether they live with a family.
Can we provide community have R if a person is receiving day have from another agency on that day?
So that's a really important question, and the answer is no. So the community have R is an allowance because of COVID, where a residential provider could bill the approved units of service for a person on days when they would have been participating in another agency's day habilitation or site-based pre-vocational services. If a person receives day have on a particular day, then you cannot also bill the community have R associated with the COVID epidemic. So it's one or the other.
As a follow-up to that, if a person receives day have from their residential provider, can they bill or provide day have services in the IRA?
So same agency?
Same agency.
Okay, so in a situation where you have agency A is the residential provider and agency A is also the day have provider, yes, that agency can deliver day habilitation or site-based pre-vocational services in the residence. That's always been allowed throughout this pandemic.
If an agency did not participate in the retainer program, do any of these flexibilities apply to them?
So that's a very good question, and I think it's important to be clear about it. Everything we are talking about will apply to all day habilitation and site-based pre-vocational services, except the flexibilities that Aviva talked about related to service authorization and the DDP-1 process. So those, and the slides indicated, those are the flexibilities that are only for folks who participated in the program, but the modified program day duration is available to all providers.
Can we bill one full unit of day have and a half unit of supplemental day have on the same day?
You can, if the person is authorized for supplemental day have, and that would be someone who does not live in a supervised residence. So that would be, the same rules. That's never differed. However, in order to do that, you must meet the regular rules for the program day duration. You cannot deliver 2 hours of day habilitation, call that a full unit, and then 1 hour of supplemental and call that a half unit. So 3 hours of service does not get you a unit and a half. If you deliver and meet the regular requirements, absolutely go ahead and bill the unit and a half, but you have to meet the regular standards.
Do any of these flexibilities apply to Icf Day Services?
They do not. These are related to the HCBS waiver services, and they're authorized through our Appendix K, which I think most of you are well aware of. So they do not apply to Icf Day Services.
Are there any flexibilities on the eMedNI billing limits for people who receive day have or site-based Prevoc in certified residences? The maximum amount of day services that they can bill.
It's the same rules. So if you are delivering day have, let's just keep it simple. You're delivering day habilitation to a person who lives at home and day habilitation to another person who lives in a residence. The same rules apply, so you can use the 2 hour for a full unit, an hour for a half unit for both folks. For people who live in a residence, the rules apply in terms of not being able to deliver services on weekends and weekday evenings. That's part of the residential provider's responsibility, so not something that the day have provider can deliver. But other than that, it's the same rules that have existed before.
Are the non-face-to-face flexibilities still allowed for community day have or day have without walls programs?
So day have, the new rule for all day have, whether it is without walls or whether it is site-based, because we don't really differentiate in our claiming, they're full unit and half unit. The new rules apply. So if you're without walls, you can deliver services as we've described here, 2 hours, minimum program day duration for a full unit. You cannot use after Monday, you cannot use the other flexibilities that we were talking about. For prior claiming, as we discussed, you have the choice during the period of July 22nd through August 23rd.
If a provider had already submitted a COVID-19 addendum to the Life Plan and Staff Action Plan, do they need to resubmit the COVID addendum?
No. So if you submitted a COVID addendum during the program, the Retainer Day program, and you are continuing to provide services in that manner, there's no need to resubmit another addendum. That covered the service provision.
Does the revenue code need to be put on for all claims submitted during this time period, or only claims that the flexibilities were utilized for?
That is a very important question, and I absolutely want to make sure people understand it. If you submit a claim and you are using the modified program day duration, you must use that modifier. And if I had a really good memory, I would remember what it was, 0249. If you do not, so you meet the regular rules, then you do not use that modifier. You would submit a claim, a regular claim, if you will.
So we can bill the old way, so a full unit for 4 hours, and we can bill the flexible way. You can do either or.
You can do either or. It's an agency's choice. I think it's just important, and I want to reiterate this. If you use the flexible service day duration, so you use the 2 or the 1 to bill a claim, then you are agreeing to the limitations that we've described here and were described in the memorandum that was sent out this week. If you don't use those modified definitions, then you're not using those definitions, and you're not held to the same standard that a provider who is using those flexibility is held to.
Can you bill community have and day have in the same day?
You can, as long as you meet the, you're authorized for both and you're meeting the standards for both, and they're clearly documented and separately provided.
Can non-face-to-face services or the delivering services while maintaining social distancing apply to respite and supported employment?
It does apply to respite. We did allow that provision. Supported employment, I believe, does also, but we'll have to go back. I don't recall the language in the documentation, but it is, if you look on the OPWDD website under COVID guidance, we have a number of guidance documents published there, but we can get back on the supported employment.
If a person was receiving a half unit of service before, can we now bill the full unit for that person? Maybe.
So that's exactly the situation when we talked about earlier in the slides that there were, that this was retroactive to July 22nd. So it could be that, let's just take an example so we're concrete. Let's say that you build a half unit of day habilitation for a person on July 23rd because you had a 2-hour program day duration. With these modified standards, you would now meet the minimum standard for billing a full unit, and you can go back and you can modify the claim like Earl described on slide 9. You can make an adjustment to your claim. You do need to make sure, if you do that, you're identifying that you are using the modified standards with that revenue code that we described earlier.
And in order to do that, do providers need to request additional service authorization?
So if you are using the modified standards, then you are agreeing to the overall limits that we described based on your prior performance from 2019. So you do not need to request additional service authorization for a person, but you are limited to that total, the total limitations that we described.
Is there a reason code that needs to be submitted with claims?
That I'm going to have to defer to my colleague Earl. Can you answer that, Earl?
Yeah, if they're asking in terms of a delay reason code, you shouldn't have to, because we should be well within the 90 days of claim submission, so you shouldn't have to worry about that. So that shouldn't be needed.
Terrific, thank you.
Can an outside agency provide day hab in another provider's residence, so they are not the residential provider?
So visitation is allowed, and if everyone is in agreement, one agency can deliver day habilitation services in another agency's residential facility. Obviously, that needs to be, an arrangement that's agreed upon by both parties.
Do we need to follow individuals' pre-COVID schedule for billing?
So during this period, you obviously need to coordinate with the person, but you are not necessarily tied to the same period of service delivery. We would expect that providers are working with individuals and families and the care manager to best meet the needs of the person, but we do understand that there likely will have to be flexibility as we're working through the startup and the reinitiation of services. But let me just ask, Abiba, is there anything else, or is there anything else you want to add?
Kate, no, not at the moment. I'm thinking about it as you were providing your updates, and there's nothing at the moment. Thank you.
Can a person receive Community Hab R and regular Community Hab in the same day?
Community Hab R is Community Hab R because the person lives in a residence, in a supervised residence. So somebody who lives in a residence cannot get regular Community Hab. I think that. Then let me go to Earl and make sure that's correct. Earl, am I right?
Yeah, yes, you are 100% right. We have edits and RE code editing that doesn't allow someone in a residence or in family care to get traditional community hab.
Excellent. It's nice to be right when you've already said something. Thank you.
Does the revenue code 0249 need to be used when we are billing for meal times?
No, the 0249 does not. We're allowing mealtimes to count as part of the program day duration. The 0249 is used when you do not meet the program day requirement of the 2 hours for a half. The regular rule is 2 hours and 4 hours. If you're delivering a unit and billing it with 1 hour for a half unit, 2 hours for a full unit, that's when you use those standards. That's the revenue code.
If somebody would like to request more respite services, do they utilize the COVID-19 addendum or have to go through the usual service authorization process?
I think I should defer that to Aviva.
Yep. So again, it depends on whether or not the circumstances of the individual. So if there's actual hours or if the respite service needs to be authorized, then you would be going through the care manager to contact the DDRO to have those services authorized. If it's a net new individual and if it's someone seeking a change, then they would be using the service amendment process to accomplish that.
Thank you.
Are the flexibilities also provided for respite services in regard to the flexible service day duration?
No, program day duration is solely a standard associated with day habilitation and pre-vocational, site-based pre-vocational services. So when we talk about the full and the half unit standards, that's for those programs and those programs only.
Can site-based pre-voc and day hab still be provided remotely?
Yes.
In order to bill the flexible service day durations, do we still need to provide 2 face-to-face services for a full unit and 1 face-to-face service for the half unit?
Yes, and that is very important, and I would refer people back to the slides. So on slide 5, we talked about the staff action requirements are not changing. So if you're billing a full unit, you must document 2 services. If you're billing a half unit, you must document at least 1 service derived from the person's staff action plan. What is changing is the program day duration requirement.
We did receive a question about what rate code should be billed for Community Hab R, and there was a memo that was sent out to providers through OPA with some billing instructions. But Earl, is there any other information you can provide?
Well, I mean, for Community Hab R, there's a rate code for group, which is what was put forth for the allowances that we did for individuals that were in IRAs and not able to go to the day programs. I'm blanking on what it is, but I can look it up in a minute, and I'll just come back to you in a second if you want to continue on.
Thank you, Earl. Sorry, we're just going through a couple more questions. Just allow us 1 minute to look through the questions that are coming in.
Lauren, I'm just going to jump back on if you can hear me.
Yes, we can hear you.
Okay, so the 4797 was the group Community Hub R rate code that was used for the allowances that we put forth before. There's also 4796, which is the individual, but that wasn't part of what we put forth for the IRAs to bill those services for individuals that were not able to go to their day programs. 4797 was the group rate code that was used.
Okay, so we're approaching time. I want to thank everyone very much for your time and attendance and everything you're doing during this extraordinarily difficult time. If you have any questions, feel free to contact the People First mailbox, and we will do our very best to get this recording ready for publication and available on our website, and we will let you know as soon as it is. So with that, I just want to say thank you all and have a good day.